and welcome to the Candida candidate. Today I will speak about the connection or the link between Candidiasis or Candida Albicans and urinary tract infection. Or let's see what it says here. Candidiasis of the urinary tract. So I will move on here, and now I can read. This is from PubMed. You can just Google Candidiasis of the urinary tract, and if you ask your medical doctor, there is a great chance that, oh no, they don't know about this. Or they give you some other diagnosis. For example, prostate. Oh, you might have prostate cancer. Oh yeah, you have to do some invasive treatment, or you can be sent to a specialist, so the specialist can do the invasive treatment, and you end up on lots of antibiotics. Yep, and that can lead to more candida and other symptoms or side effects. Well, let's start. Candidiasis of the urinary tract. There are similar articles about it. Candidiasis, treatment of severe Candida infections with ketoconazole in newborn and young infants. Yeast in the urine. To treat or not to treat critically ill patients with Candiduria. So you can find articles here. I will go on to the next one. Candidiasis of the urinary tract. This is on what is the name of this? eliveok.com, iLive or eLive, iliveok.com. Anyway, let's read a little bit. Causes of the candidiasis of the urinary tract: diabetes mellitus, catheterization of the bladder, urolithiasis. Prolonged use of broad-spectrum antibiotics can cause disease. Symptoms of the candidiasis of the urinary tract. Candidiasis is characterized by frequent painful urination. Candida pyelonephritis is characterized by pain in the lumbar region, fever, and pain when urinating. Diagnostic of the candidiasis of the urinary tract. Diagnosis of candidiasis of the urinary tract is based on the detection of candida spores in urine and assessment of the patient's condition. It is important to correctly understand the clinical significance of the detection of candida spores in the urine. Most patients have asymptomatic candiduria. I hope I pronounce it correct, but anyway. Which indicates the colonization of candida spores, lower urinary tract. This fact is not considered an indication for the use of antimycotics. Sufficient elimination or correction of risk factors. Candiduria in combination with clinical or instrumental signs of urinary tract infection is an indication for the use of antifungal drugs. In addition, candidiasis of the urinary tract can be a source, and candiduria, a manifestation of invasive candidiasis. That is why, at the high risk of developing invasive candidiasis, the presence of risk factors, presumed clinical signs, and additional examination and decision on the appointment of antifungal therapy are indicated. Who to contact? Urologist. Well, in my case, I think the urologist rather prefer to treat you as if this condition is prostate cancer. And first they have to take a biopsy. They have to stick some needles through the urinary tract into your prostate. And they have to do the same through your anus. And that will probably cause infection, and that again makes it necessary for them to prescribe antibiotics so you don't die from the infection. And it is a very invasive treatment. And you might be away from work for several weeks if you have this infection, actually. Well, let's move on. Treatment of the candidiasis of the urinary tract. Treatment is carried out by patients with clinical signs of urinary tract infection or with asymptomatic candiduria and the presence of risk factors for the development of invasive candidiasis. Treatment of candidiasis of the urinary tract consists of the use of systemic antimycotics, the removal of replacement of urinary catheters, in the elimination or reduction of the severity of other risk factors, optimization of the use of antibacterial drugs, correction of diabetes, etc. The drug of choice is fluconazole. Unlike other antimycotics, it creates a high concentration of the active substance in the urine. When fluconazole is ineffective, a bladder washing with amphotericin B solution, usually accompanied by a temporary cessation of candiduria, is used. But this method of treatment is ineffective in the case of the lesion of the overlying parts of the urinary tract. With fluconazole ineffectiveness and possible damage to the renal parenchyma, caspofungin or voriconazole is used. Yeah, you can read a little bit more on your own maybe, but I think you should rather try the Candida diet. I will not explain about that here, but you should eliminate sugar, honey, fruit, juice and sweet drinks for some time. and perhaps you should go on a ketogenic diet. That means eat meat, fish, egg and vegetables for a period of a month or two. And you can use some coconut oil in your hot drinks. You can use a few drops of oregano oil in your hot drinks as well. And maybe pine oil, essential oil from pine. Just a few drops, and dilute it, because it is very strong stuff that. Well, let's move on to the next. We have been here, yes, and this one, Dr. Fungus. Let's see, overview. Candiduria refers to the presence of Candida spores in the urine. The finding is, for the most part, a benign associate. My picture. Up here you go. The finding is for the most part a benign process associated with the use of urinary catheters and antimicrobial therapy. Nevertheless, Candiduria may be one of the most challenging of the candidal infections. The challenge comes from the fact that finding Candida spores in the urine can be either completely insignificant or asymptomatic colonization, or be a marker of a very serious entity such as invasive renal parenchymal disease related to disseminated candidiasis or post-laparotomy peritonitis. In between these two extremes are other important clinical possibilities: candidal cystitis and fungus balls that also require specific treatment. Causes of Candiduria. Category condition comments. Benign contamination. Sorry about the phone. It is not. I forgot to turn it on off the sound. Okay, contamination from external genitalia. More frequent in girls, women due to vaginal colonization. Colony counts tend to be over 10 in 3 mil. I'm not sure how to say that. Insignificant Candiduria, seen with indwelling urethral catheter, antibiotic treatment, old age and pregnancy. Colony counts as high as blah 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 blah. Catheterized patients. And now it's urethritis. Occurs in both men and women, usually related to balanitis and vulvovaginitis, respectively. Okay. Balanitis. That is for men, and a vulvovaginitis is for women. Cystitis. Related to indwelling urethral catheters and diabetes. Many cases are asymptomatic. Visualization via cytoscopy and is the only way to confirm. This is urinary tract related. And now prostatitis, rare but described. Fungus ball formation, bladder, renal pelvis. I just wonder. Commonly associated with urinary tract obstruction. See fungus ball. And now upper urinary tract candidiasis due to ascending infection. A variety of pathologic findings can occur, including papillary necrosis, perinephric abscess, emphysematous pyelonephritis, and calyceal invasion. I'm not sure if I pronounce it correct, but let's just think I do. And usually associated with urinary tract obstruction. Next one is hematogenous candidiasis with renal involvement. Upper urinary tract candidiasis as part of the syndrome of acute disseminated candidiasis. And the kidney is one of the most frequently involved organs in this form of disease. Colony counts in the urine may range from 0 to maybe very much col per milliliter. Even though imaging studies of patients with chronic renal candidiasis show cortical renal abscesses in about 1/3 of cases, Candiduria is an exceptional finding. See hepatosplenic candidiasis. Epidemiology. Wow. Epidemiology. It's a little bit hard for me to pronounce all these medical terms. The overwhelming majority of patients with Candiduria suffer a completely benign process. Indeed, the largest study ever published on funguria found that only 7 patients had documented candidemia among 861 consecutive patients with Candiduria. However, funguria is sometimes a marker of disseminated candidiasis. Approximately 10 of cases of candidemia are related to a urinary tract source in one study of 104 patients with funguria. 10% were diagnosed with candidemia either simultaneously or within a few days of detection of the funguria. Importantly, 1/3 of these cases had obstructions in the urinary tract. The other 2/3 had classic risk factors for invasive candidiasis. This study appears to be unusual, as most other studies have found that Candiduria is a benign finding. There is a lot of stuff you can read on your own, but diabetes mellitus is a factor. Urinary tract diseases producing obstruction, and a lot of other stuff here. You can find out on your own. Clinical manifestation. Clinical manifestations are of little help for physicians dealing with funguria. Symptoms like dysuria, frequency, and urgency were presented only in 2 to 4 of patients with Candiduria studied by Kaufman. Patients with urethritis and cystitis, if symptomatic, will be present with the same symptomatology as is seen with the bacterial urinary tract infection. However, catheterized patients rarely have these complaints, and when they do, it is not possible to decide if the symptoms are caused by the catheter itself or are related to lower urinary tract infection. And it goes on. Specific diagnosed strategies and a systematic approach to the urine culture positive for Candida spores. Treatments: oral fluconazole, amphotericin B. Well, again, I will rather ask you to first try a Candida diet. It is non-invasive and it will probably be much better for you. Difficult clinical situations: urinary fungus ball. We can click on that one. And overview. This condition, sometimes called fungal bezoar, is classically caused by Candida spores. However, penicillium have also been reported as a cause of fungus balls. Epidemiology. Fungus balls are commonly associated with the following underlying conditions: diabetes mellitus, nephrolithiasis, any other cause of urinary obstruction. Patients with fungus balls may have almost any presentation. Asymptomatic fungus balls are seen when the obstruction is incomplete. Complete obstruction is often associated with urosepsis-like picture that includes fever, chills, and flank pain. Some patients will report having spontaneously passed with debris, fungus balls in the urine. Specific diagnostic strategies. Therapies. Percutaneous nephrostomy with subsequent irrigation of renal pelvis with amphotericin has been explored in individual cases. Satisfactory results. Oh my god. This is something you can read on your own. And let's move on to the next one. This is a picture. This is a picture from fungus in the urine. This is a picture of urinary tract relief. I have not tried it. I don't know if it can help at all. And there is another one. And this is urinary tract complete, cleanse and support, organic relief from UTIs, burning, frequency and more. I have not tried it, so I can't recommend it, but there are some supplement that you can buy, but again, use the Candida diet. You can Google Candida diet and you can find a lot of information about it. I will make videos about Candida diet later on. But now I will do only this video about urinary tract candidiasis, and I think you have found very much now. Let's see here, this one, and this one, and this one, this, and this, and let's move on. There is a long list here. Candida Urinary Tract Infections, treatment options. You can find a lot of articles. You just have to Google what I did. I did Google urinary tract candidiasis. Urinary tract candidiasis, and I got all these. I have been on this one, and this one, and this one. Candida Urinary Tract Infections and Treatment. There are a lot of pictures. Urinary Tract Candidiasis. Report of a case with bilateral urethral Candida in the urinary tract. The Candida plan. Can you have a urinary tract infections caused by Candida? Candida urinary tract infections, diagnosis, clinical practice guideline for the management of Candidiasis. So as you see, you can find so much information online if you just Google the right words. If you go to a medical doctor, you might get misdiagnosed and you might get some treatment that will give you some side effects, and you might get some treatment that won't work at all, and you can have problems for a long time before you find out what is actually going on. So this is my information for you today. I hope you like it and hope you subscribe, and I hope you can pass on this information to other people that really need it. You can share my video if you think that is good, and I am happy that you watched all the video, and I will complete the video now and say goodbye. Thank you for watching. I am so happy that you are following me. Thanks for now. Bye.